Morning, everyone. Morning, everyone. I'm Prajakta Wadhavkar, and I welcome you all in this webinar session organized by the International Longevity Center India with the CSR support of Geriatrician Chemicals Limited. We have two reasons to be here today. Today is World Alzheimer's Day. It is celebrated worldwide on 21st September each year. Interestingly, 21st September is a birth anniversary of our founder, president, and renowned social scientist, Dr. late Sharat Chandra Gokhale sir, who contributed so much to the aging field through his brilliant ideas and pioneering work. So I bow to him and wish you a very happy birthday, sir. Coming to today's webinar, we have two guests. The first session will be delivered by Dr. Prem Narasimhan, and the second session will be delivered by Ms. Prajakta Wadhavkar. Welcome, sir and ma'am. I now would like to introduce Dr. Prem Narasimhan, and then we will begin the session. Just give me 1 second. Okay, I would like now to introduce Dr. Prem Narasimhan, and then we will begin the session. Dr. Narasimhan is a chief consultant and founder of Geriatric Medicine Department at Jaslok Hospital in Mumbai. He's an elder care specialist. He has done MBBS and then MD in geriatric medicine. He was previously an assistant professor at AIMS. He has around 8 years of experience in this field. He has many publications. He has written a book chapter in international renowned journal. He has been extensively involved in telemedicine for older adults for both COVID and non-COVID cases. He has been conducting support groups for older adults as a part of graceful living. We have invited him as guest speaker for our earlier online sessions. Thank you for being here with us today. I request now Dr. Prem to begin the session. Thank you. So, over to you.
Yeah, thank you. Good morning, everybody, and thanks for that introduction. I think September always is celebrated as the Alzheimer's Awareness Month, and most importantly, I think this month and today, of course, being the World Alzheimer's Day, should be taken only as an opportunity to spread the word, but throughout the year and every day, we should remember that dementia somehow, because of COVID, had gone back into the background for the last 2 years, but dementia and Alzheimer's has been very much rampant, and in fact, people with dementia to an extent have worsened during this time, and a lot more of older adults have discovered that they have cognitive problems during COVID as well. So it is very much a pandemic which was there much before, but it wasn't always highlighted purely because there was a misnomer that not a lot can be done about it, which is absolutely not true. So today, of course, I'm going to be talking about Alzheimer's and just introducing Alzheimer's to you. I would go more in the form of, I think, more of a myth buster today, because I think that's what I would want to do. So let me just put a perspective here. One has to understand that it is one of the most, it is not the disease that is the problem, it's what it causes. So it's one of the leading causes of loss of independence in older adults. So one has to understand every older adult wants to be independent to the last day of their life, not being a burden on anybody. But Alzheimer's disease, when it gets worsened, it really causes loss of independence in older people. Then older adults have if you ask them personally, which I have asked, the Reddit is memory recognition, able to do things they do every day in their quality of life, and that really scares them. So they are really fearful as far as Alzheimer's is concerned. Now it is one of the common causes of dementia as well, and I will get to that because that is another one of the myths in which I'll get to it in the later slides. Now, the global and the Indian burden of Alzheimer's disease is just increasing. So one has to understand that it is a burden which has been increasing for quite a while, as more and more of our population is also aging, with medicine actually improving. We are seeing older people living even more longer. So for example, earlier, if our overall lifespan was hardly maybe in the 40s, now well, and it's around 60 and 70, people are living more. In fact, more and more centenarians and more people are living to the age of 100, more than 75, more than 80 and 90. So the COVID-19 pandemic hasn't really helped. It has only worsened the risk as far as dementia is concerned and Alzheimer's is concerned. So we have to see that, are we ready in case of not only a healthcare part, but in a human resource part to take care of Alzheimer's, because it's not only curing which matters in Alzheimer's, because we know that it is not a completely curable disease, but caring matters. So how many people do we actually have who are well trained, who are going to be able to take care of people with Alzheimer's? So that is an important thought which needs more discussion as well. And of course, coming to the myths. Now, myths, I want to do some myth busting as far as Alzheimer's is concerned. So, first myth, which is one of the important things that all older adults and their caregivers should understand, is that memory loss is a normal part of aging. No, memory loss is not a normal part of aging. Yes, there people might forget or have forgetfulness, but that does not necessarily mean that it is a very normal part of aging. Usually people do get it, and if there is more and more memory loss, then it's actually pathological. So the fact here is, as people age, yes, it is normal to get a bit of memory problems. So for example, forgetting the name of a person you have recently met. But that is an occasional memory lapse. A person who's got Alzheimer's will have more than the occasional memory loss, because it is something that has to be taken seriously. It is a disease that causes the brain cells to malfunction and ultimately die. So when this happens, an individual may actually maybe forget the name of a long-time friend, or maybe the roads they return to the home which they have actually been taking through decades. Then there might be a sense of wandering. There might be a sense of not being able to do their finances, not being able to do easy calculations or easy things which they used to do. Which maybe they are not able to do at all. And these lapses are very much true. So you cannot take it as a normal part of aging. Then, of course, Alzheimer's disease and dementia are the same. Absolutely not. People often use the terms Alzheimer's and dementia interchangeably, but there is a difference. See, dementia basically refers to the impaired memory, thinking, reasoning, and behavior. And Alzheimer's is just one part of dementia. So one can obviously say that dementia is that umbrella term in which there are different types of dementia, and Alzheimer's is only one part of dementia. Yes, Alzheimer's is the most common type of dementia and most common cause of dementia. That's why it has been talked about even more, and it is very much in percentage also maximum. But there are other types of dementia as well, like, such as frontotemporal dementia. Of course, in the non-reversible dementia. So there is a frontotemporal dementia. There is also a vascular dementia. There is a dementia with Lewy bodies, then Parkinson's disease associated dementia. However, there are certain reversible causes of dementia as well, like hypothyroidism, vitamin B12 deficiency, chronic subdural hematoma, and also even normal pressure hydrocephalus. But yes, but today we are focusing more on the Alzheimer's part, myth busting, so I will not go into that. Then one of the common worries that an older adult usually has is, if I'm forgetting things, then I'm actually having Alzheimer's disease. Now, no, that is again not a necessary. Even though memory problems are typical or one of the signs of Alzheimer's, not all memory problems mean a person has disease. So now some forgetfulness is normal as we age. Now, another thing is, we always think dementia, Alzheimer's whenever a person gets Alzheimer's, it's only going to be the memory that is get affected. No, memory is only one of the domains which gets affected. For example, doing complex tasks, orientation. A person who was driving will not be able to get the directions. So all those things also sort of change. Language, when even trying to orate, trying to speak certain words, vocation gets also affected. A person does not recognize, maybe if it's a very bad dementia, Alzheimer's, then the person might not be even able to recognize one's own image in the mirror. So there are a lot of domains. So we can always think that a person who has only memory loss might end up getting Alzheimer's. No, memory loss is one of the domains. There are other things also which might be affected. So one has to be very keenly looking at them. So another myth is, if somebody in my family has Alzheimer's, I will get it too. Well, fact is that when a parent or close relative gets the disease, one obviously might be worried. And to be very frank, be worried when one gets older, there is a greater chance of getting Alzheimer's. Yes, there might be, if you have certain genetic mutations or variations that can be passed on from a parent. However, just because a biological parent has it doesn't mean that the children will also develop it. However, if there is a family history, one has to do screening, memory screening at an earlier age, screening camps at an earlier age, so that you actually know that your brain function is preserved. Then again, memory loss is the only symptom. That's another myth. No, memory loss might be the most recognizable symptom, but other symptoms include challenges in planning, solving problems. And it is planning means planning maybe anything normal, like even making a dish or a recipe, which used to be very, very easy earlier, but it's not been able to do now. Now, difficulty in completing familiar tasks, like even sort of doing calculations, bathing, confusion with time or place, not understanding what the time is, what the place is, not understanding the relationship between space and objects. This is why direction and driving can be a problem. Problems with writing and speaking, then losing the ability to retrace the steps also. For example, if there is the keys have been misplaced, so even trying to retrace that, okay, I was in this room, I kept the keys here, that also becomes very, very difficult. Then misplacing things, poor judgment, ultimately even withdrawal from social activities. Earlier, a person who was an absolute extrovert, trying to join in, trying to do things, does not now even have any part in any activity. And then, of course, as we go ahead, as things get a bit more bad or worse, then there might be changes in mood, personality, and behavior. So behavioral disorders, along with Alzheimer's, can be a bit more difficult to treat. So that becomes a bit more prominent when the person has a worse form of dementia. I mean, worse form of Alzheimer's dementia. But what I'm saying is, memory loss might be the only recognizable symptom, but it is not the only symptom. So one has to understand that when you are looking at your any kin who's actually might be having memory loss problems, try to see other things also. Then there is another myth, thinking that it is not fatal. Now, yes, a cardiac disease, when a person gets a heart attack and the person is on angiography, has to do surgeries, maybe even angioplasty, then the chance of risk is more. A person who's got stroke uh, and gets paralyzed, and maybe there is also a bleed in the brain, then the chance of death is more. But thinking that Alzheimer's is not fatal is actually a fatal mistake. Why? Because Alzheimer's disease has no survivors. It destroys the brain cells, it causes memory changes, it can cause erratic behaviors and loss of body functions. And the worst part is, it slowly and painfully sometimes takes away a person's own identity, an ability to connect with others, an ability to think, eat, talk, even walk, and find their own, his or her way home or to a familiar place. So to say that Alzheimer's disease is not fatal is not right at all. It's a disease which withers away one's own identity, not only from the society, but from one own self. And that can be the worst case scenario, because it not only affects their social relationships, and ultimately it can also cause a huge caregiver burden and caregiver stress, in which taking care of an Alzheimer's disease patient is not quite easy. So the Alzheimer's disease not being fatal is again a myth. One has to understand that just because there isn't sort of you can say, a sudden sort of change in people with Alzheimer's disease when it pertains to maybe a heart attack or maybe a stroke. They are also liable to a heart attack or a stroke. They are liable to infection. So I think this is because of an issue. Then what about warning signs? Now the warning signs are very, very important. See, if you see the 10 early signs of Alzheimer's, yes, memory loss is one of them. Then there could be social withdrawal. A person might have poor judgment, then changes in mood, misplacing belongings. And a lot of times there is misplacing of belongings, whether it's their own medications, whether it's the watch, whether it's the keys, whether it's the spectacles. Then hard to complete familiar tasks which were very easy, like even writing the month's finance or writing the month's budget, making things that have to be bought. Then confusion of time and place. Then changes of vision, yes, struggling to even communicate. So all these things might be early signs, and it's not necessary that a person will always only have memory loss. They might have the other signs as well. So one has to be very, very careful in actually understanding that this might be leading to Alzheimer's. Now, early detection. See, the theme even this year is about diagnosis and detection of World Alzheimer's Day, and I think that is very important. To talk about the disease is one thing, to spread the word, to sensitize people is another thing, and to make people to actually focus on the fact that it has to be detected earlier is very, very important. Now, why is early detection important? Why? Because it helps in the person and to establish an ecosystem. By that I mean an earlier access to the pharmacological part, that is if medicines are needed, and even behavioral and psychological, psychosocial support, which is not only for the person but also for the families or the caregiver. Now it is very, very important that one has to understand that there is not only a pharmacological treatment of Alzheimer's disease, there's also a non-pharmacological component which will be discussed later. But if I have to just mention, there is art therapy, there is music therapy, there are a lot of ways where a person with Alzheimer's can be made more independent and can be contributing more. Then earlier detection allows the families to take time to plan for the long term care, because these are practical things that a family will have to plan, whether they will be able to take care at home with a caregiver or themselves, or they might have to ultimately transition them into a long term care or an assisted living home. Then handling legal matters are also very important. So these are things in which an Alzheimer's disease patient might be in a plateau for a while where there might not be any change, but after some time, the person might actually worsen. So legal matters and end of life support can also be dealt with earlier. So it helps in planning of a person with Alzheimer's disease if there is earlier detection, rather than it being detected at a later stage wherein dealing with a lot of things is difficult. Now, a caregiver also and the person themselves might first be in denial about the disease. Then obviously more and more education comes. Now the caregiver has to take care of themselves, go to win support groups in discussing about the disease, but at the same time they should also be taking care of their own health. One of the very important things that a caregiver or a caretaker or even a healthcare professional has to understand, that a person with dementia is still a person. We sometimes tend to focus so much on the disease that we forget that there is a person who is absolutely there with full dignity to be maintained inside the person with dementia. So let's treat the person and not only the disease. Now, yes, there are strategies for prevention of dementia and Alzheimer's as well. Now, regular exercise helps. Social engagement is very, very important. This is what we found during the pandemic, that the social engagement had decreased. A healthy diet always helps. Mental stimulation is very important. Now, the brain in general gets very bored. So, even writing from the hand, which is not your dominant hand, helps. Brushing from the other hand helps. Giving a challenge to your brain, maybe a new skill, music, gardening, whatever works. Even meditation is important. Quality sleep is very important. Sleep is something which has always been neglected, but sleep from a very young age, if it is good, it only helps in re-energizing the brain cells. Then I think stress management is very important. Now, the more as we go ahead, it just seems that the amount of stress is increasing. but one always has to have their own time. One has to relax, because ultimately I think that is the most important things that one has to do, is to take less amount of stress, but at the same time manage it well. Then vascular health. By that I mean, if a person has diabetes, hypertension, heart disease, stroke, all those things have to be maintained properly as far as vascular health is concerned, because not maintaining the vascular health will always be sort of a risk for the development of Alzheimer's or dementia. So one of the very important things which I want to substantiate is there is also a role of memory screening camps, because the more we are able to screen, it can happen in societies, it can happen in small enclosed places, it can happen even in hospital setups, wherein screening for memory at least maybe in your 50s and then going into the 60s is very important, because see, ultimately there shouldn't be a fear that no, my god, something will be discovered. It should actually be helping you to think, yeah, if something is discovered, then treatment is available and I will be able to sort of maybe engage myself earlier. There are always memory aids, memory cues in which you can improve your memory. For example, writing down whatever you need to do, having reminders even in the phone, even in the computer. So all these things taken together can help or increase your life. Then there are other things as well. Social engagement, I think, as I have mentioned, is very, very important, in which you have to be having, whether it's friends, families, whether it's your colleagues, whether it's some intergenerational. I think intergenerational bonding really helps, wherein people with different ages, a younger person with an older person, it helps. Companionship is very important. Isolation is something which can be really, really sort of not take care of the mental health of a person and put them mentally down, even if they have Alzheimer's. So a person with Alzheimer's disease can also have depression going on together. So that also is something which has to be sort of taken care of. So I think one of the very important things we have to remember is, let us remember those who forget, and it is not only on this month, not only on this day, but throughout, so that we can not only give them a better quality of life and independence to whatever time they still have, but at the same time remember that it's about not, it might not be about cure entirely in Alzheimer's, but it is about care. So we have to make sure that the care ecosystem is established, whether it's about taking care of the person, the caregiver, whether they need an attendant or whether they need full-time assisted living care. So ultimately, the human resource development and training, I think, is one of the very important things. And the real takeaway is that early diagnosis always helps, because it not only helps the healthcare professional, it helps the family to plan better and to actually have a better plan earlier in life to tackle a detailed continuum of care which can happen in a person with Alzheimer's disease. So this was in short about Alzheimer's disease. Thanks a lot for your patient hearing.
Okay. Yes. Thank you so much, Dr. Prem Narasimhan. It was uh, it was really a mythbuster presentation, and I appreciate your efforts of systematically giving what exactly the Alzheimer's disease, because I know the time was really short, but you really did well. So thank you so much for this. Sir, we are actually planning to take questions later. Would you like to just go with it, or should I ask questions right now? Yeah. So can we take questions right now?
Yeah, if you can take question right now, I'm okay with that as well. Whatever goes is fine.
Because she has been going. Yes. So we'll just take questions right now. So participants, if you have any questions, please raise your hand or unmute yourself, and we will be taking 3 questions at this point. Please, anyone? Yes, Padmavati ma'am, please unmute yourself. Yes.
Yes.
Yes, ma'am. Ask questions. Thank you.
I am Mrs. Padmavati Krishnan.
Hello, ma'am. How are you doing? Yeah.
Hello, can you hear me?
Yes, ma'am. Yes, ma'am.
See, I am 64 now and I am staying in Mumbai. So actually, when I was in 50s, in the beginning of 50, 51, 52, that time, I used to forget quite a lot. In the sense, suppose somebody asks for something to be served on the plate in the bedroom, I will say yes, and I'll go into the kitchen, I'll forget, I'll do something else and go into the hall and sit. I mean, then my mother used to call out, "Arey, you are going to bring me that." I mean, but the thing was the domestic situation. My mother was completely bedridden. She's still completely bedridden with caretakers at home. And I have two daughters. One is married, the other one is working outside Mumbai. So the thing was that then at that point of time, I didn't know much about, but I had in our family, my uncle's wife, my auntie was having Alzheimer. So what I thought was, first let me take up some studies which will make me remember and write exams. So I took admission in MBA, Banking and Finance. I was working for Reserve Bank of India at that time. So what happened was that really helped me because I underwent all the exams, the CIB, JIB and all. And what happened was that it made me remember things like, and this forgetting spells had become very, very less. So, and then I observed that, as you said, that stress, when sometimes many things come together, stress is together, I used to forget. So then I started learning to relax. And now during actually Corona period, because I was interested in value education, giving to children and all, I started online classes and then some elders they wanted. So on the spiritual angle, some Adhyatmic lectures, I am listening and I am doing it, for which I read, I write and do. So that has given me a lot of relief. So whether should I go for screening or something, or whether this is fine, I just wanted to know.
Yeah, so I think first of all, I think Padmavati ma'am, you have been quite a bit of an inspiration in trying to do all these things because you profess the thing which I tell all older adults that there is no real age to actually learn, and in fact, learning and exercising the brain only helps you to enhance your memory better. I would still say that it is always better to get a memory screening done because it will not harm you in any way. All you will end up knowing is everything is okay because you're already doing a lot of things to keep yourself engaged, and you have not only engaged yourself socially, you have also engaged yourself intellectually. So I think that is a good way to go about. So memory screening would always help. But thanks for sharing your experience. I am very sure that it's going to motivate more people to even take up. Thank you.
Okay, thank you, doctor. But screening part, I never knew that there is something as a screening to know this. But where and how then can you give it to us in this lecture, wherever we have to, or in PPT, if you can send us the PPTs along with that, where and all, how we have to go about, that will
Yeah,
be.
so actually, ma'am, what you can do is you can, I have actually shared my email ID. I can write it on that. You can actually mail me and then we can get in touch. I'll let you know.
Sure, doctor. Thank you so much.
Okay.
Namaste.
Thank you, Padmavati ma'am. Thank you for sharing your experience and thank you for joining. Prem sir, we have a question. Should I read it out? Can you see in the chat box?
Yeah, I'll.
Okay.
Well, sir, to be very frank, without knowing the entire history of this particular person, it will be difficult for me to comment. But the best thing of doing, of course, what is the reason for the drowsiness during the entire day and sleeplessness in the night? It could be a lot of plethora of reasons. There is something known as obstructive sleep apnea, in which the person does not get sleep while lying down. So that could be a problem, and it could be infection, or it could be a lot of diseases. But I would say ultimately one has to make sure that the older adult is very active in the morning time so that they get tired enough to actually sleep in the night. But yeah, I mean, to be very frank, more details would help so that I can actually advise. I think yeah somebody is raising the hand. I think Mr. Patil is also raising the hand, if you can see.
Yes. So, Dr. Patil, sir, if you have any question, yes. Please unmute yourself, sir. So, please unmute yourself. Patil, sir, unmute करता स्वतःला, please. आपल्याला करतोय. He is the host.
If you're losing time, then we can take it afterwards as well.
Yes. Patil sir, okay, we'll take your question later. Just a bit. We have our second guest speaker here. I will just introduce her and then we will begin the session and we'll take all the questions. Thank you, Dr. Prem, again for being here. Yes. Yes, sir. Sir, speak up, please. Bola.
Patil sir, please speak.
No, take it. Fine. Patil sir, please.
We'll take it afterwards.
Okay,
to Prajakta.
Yes. Ms. Prajakta Wadhavkar, ma'am, you're here, right? Prajakta, ma'am?
आपणच गेलो बाहेर.
Ma'am, can you hear me? नंदकुमार काय होता?
बाहेरच पडलो का आपण?
Sushant, आवाज.
Oh, you are there. We can hear you.
Okay, fine. Yes, thank you. So we have our second speaker with us, Ms. Prajakta Wadhavkar. Just a short introduction and then we will begin the second session. Ms. Prajakta Wadhavkar is our second speaker. She is the founder and managing director at Tapas Elder Care, Pune. She is an expert for training at Nivara Old Age Home and volunteer counselor at Muktangan De-Addiction Center. She has experience of working at various old age homes and psychiatric rehabilitation centers in India. She has run advanced courses for palliative care at Bangalore. Her empathy and visionary ideas have helped her creating Tapas as a highly positive, amazingly designed, age-friendly ecosystem. Welcome, ma'am, and I request you to please begin the session. Thank you. Over to you, Prajakta, ma'am.
Hello.
Yes,
I'm
ma'am.
so sorry to join late. There was sort of an emergency here.
Okay.
Just couldn't do this. I'm very sorry.
It's okay, ma'am. Yes. Ma'am, can you switch on the video, please?
Is it fine?
Yes, we can see you.
Yeah.
Thank you. Yeah.
I'm Prajakta Wadhavkar and I'm very sorry to join a little late today. I was caught up in an emergency because I'm at the center here. So I'm really sorry about it.
No problem, ma'am. Yes. We can just start the session. Yes.
Yeah, so today what Yashoda had actually asked me to talk about is the active engagement of a person with dementia. And this is what exactly we are doing. I started this center 6 years back. And when I started a center focused on dementia and Alzheimer patients, we realized the need of a very structured routine and structured activities. So it was very important for us to engage them throughout the day. The challenges, what I can discuss and why we designed the activities were like disturbed temperaments, or unfortunately when people used to approach us or bring their parents or family members with dementia to an institution, so that was a huge decision for them. By the time they come to us, it's a very later stage or in a very disturbed state when they're manageable at home. So that used to be the biggest challenge. So more than medication, I can say the therapies used to work better when they have a very structured routine, diet. They start feeling secured about the place. So the staff training became very vital. So gradually we developed this model of care where activities play a very important role. So active engagement into activities is what I say. We used to plan creative activities during the mornings and physical activities during the evenings. So as a creative, so we had to focus on cognitive stimulation, emotional stimulation, memory enhancement, hand-eye coordination. So these activities are developed focusing on these skills where we can hope to enhance these skills. early stages, we do advise and train family members to take up these activities at home also. So when the family members start noticing few symptoms, few unusual things that their uh, parents or the senior members in their family are doing, first I would really suggest them to actually approach experts in these fields. They would be able to guide and exactly an assessment, neurological and psychological evaluation helps the family members as well as the care team at Tapas to know what to focus on. So this evaluation actually states all these skills and their ratios. When we get the evaluation report, I said, I have a team of therapists, actually vocational therapists or speech therapists and art therapists. So these kind of activities are happening every day at Tapas. Creative activities as in painting, these are also focused on with Indian context. So the 75 age and above residents, what they used to do, what they used to enjoy during their childhood is what I actually try to find out. And numerous festivals, Indian festivals do help, the cultural events do help to plan such activities. Definitely our psychiatrists and neurologists also play an important part to plan these activities. So board games and things like from everyday life, like rangoli, cooking, and clay modeling, such things immensely helped our senior members here. We don't call them residents, we actually call them Aji Azubas. So these have really helped Aji Azubas actually not only physically but mentally, as in to keep their temperament steady, to make them happy. They interact more with each other. And generally, when they have a good time in the morning, they have responded well to the treatment. To their food intake has increased. Their temperament has become more steadier. And in general, the whole objective is actually the quality of everyday life at Tapas. So activities definitely play a very, very important part in this. So these are few activities are what we do individually focused on their individual weaknesses or challenges. There are few social activities as in fun games or doing it together. Just today it was Alzheimer's Day, so we had a yoga session and people actually did yoga sitting in a chair. They could do exercises, they could look at each other, follow instructions. And that is our happiest moment when they actually follow, comprehend, do it, and then they enjoy it. So we actually did a very fun yoga session today. It is actually right now followed by a dance session. They are actually, all of them are dancing, and I had to close doors of my office just to hear you. So dance is something, so these basic impulses, human instincts like art, music, dance are the activities which they respond to the most, is what we found. So around dancing, there are very memory enhancement techniques that we use. The kind of songs they used to sing. We ask them to complete the songs. We ask them to complete the sentences. The most fun activity around this is we have, big poster images of heroes and heroines and singers made at Tapas, and we put them up. And then when they recognize their favorite film heroes, they love to remember those songs and they love to dance to it. So it all then follows. But then we realize that these are the things that they never remembered. They have forgotten their own family members. But they do remember, and we have sessions where we show them pictures, because picture memory is something which definitely works and which has given us excellent results. So we always, there's a checklist when they come to Tapas. So in that checklist, the foremost things that we ask them to bring are the family photographs. and we print them and put them on the walls, and we can, actually a point of conversation we can have with them. So along with the family pictures, we ask them about the moments and the good times spent together. And then they start remembering. So what feedback about this from the family members is that they have a good quality time when they actually visit now. They can talk about it. We do train family members on communication skills with dementia patients. So asking them questions, asking them to identify or giving instructions need to be avoided even at home. During early stages, they are so confused, they don't want to be instructed, they don't want to be given multiple options. So activities, when we say active engagement of persons with dementia, it actually starts from the environment, from the communication skills of the caregivers, the secured environment that we create for them, and professional experts to take up these activities. So I would suggest family members as well as the caregivers to actually focus on evaluations and the temperament of persons suffering from dementia. It is not only about memory, it is about the cognitive impairment which we need to focus on. Gradually towards the later stages, what we've seen is loss of balance, loss of language, loss of memory of basic skills like eating and swallowing. So towards this journey, we need to enhance these skills also. Of course, entertainment, learning is a great part of it, but quality of life needs to be the ultimate objective. So also this journey, when I talk about, because today I'm not doing a very formal presentation of this, because person with dementia, there are so many various different stages of it, the interpersonal relations and family members that they have, and the line of work. So all these things need to be taken under consideration. Here at Tapas, we had this very great project last year with students of game design from IIT. So we have designed few games throughout the infrastructure here, and they actually love doing it. But even during active engagement, what needs to be kept in mind, who's taking care even at home or an institution or a hospital, that to even respond to these active games, the person needs to be in a very steady, happy temperament. So for that, I guess we need to work more. There are different hundreds of creative ways that we come up with these activities. Most of the festivals are actually, we grab these opportunities at Tapas to introduce new activities. So this for Diwali we are preparing where they can participate in the whole celebration. Right from making clay things made from clay, or actually making Diwali sweets. So during making of these Diwali sweets, we have memory games, we have Antakshari going on. So this is the way any activity needs to be carried out. Yashoda, can you specify if I am missing out anything or anything more that you want me to say? Yashoda?
Yes. Ma'am, can you hear me? Okay.
Yeah.
Okay. Yes, ma'am. So we are actually on the line. So, ma'am, can you please elaborate if people dementia is like stages. So we are talking about Alzheimer's here. So can you just say anything about Alzheimer's cases at your center first? And secondly, at home, what kind of care we can take? I mean, if there are primary caregivers involved who are also seniors, so what kind of games or something, can you please elaborate on that? Yes, thank you, ma'am.
So at home, the kind of care that they need is constant monitoring, basically. Their timing about food, medication, and sleep needs to be on track. For that, uh, we do have counselors at Tapas to advise them on how to take care at home. So all these things need to be on track because sleep and food timings are very important. After that come the activities are very important, but for that, other things with medication, the place where we need to take the activities needs to be very fresh and encouraging, you know. So people around, if even if one caretaker, caregiver, or a family member, or
Ma'am, ma'am, we are not able to hear you.
hello,
Huh.
yeah,
Yes, ma'am.
I lost the line.
Hmm.
So if any one person at home is slightly stressed, the person with dementia is going to sense it, and so the communications.
Ma'am, we can't hear. We
Yes.
can't hear you, madam.
We are not also hearing you very.
Yeah,
Yes.
it's not at all audible.
We are not able to hear at all.
Yes, yes, I got it. She lost the connection. Just 2 minutes. Give me 2 minutes. She has lost the connection. Okay.
But right from the beginning, she was not audible. Doctor was audible, but this madam was not
From the
audible
beginning,
at all.
he is not hearing.
Okay. Okay. Actually, we were able to hear, ma'am, but okay, I'll check. She's there in the presentation. Prajakta, ma'am?
We were able to hear, but very less volume was there.
Yes, ma'am. Yes. It might be because of the fluctuating connection, but let's wait for 2 minutes. Yes, ma'am. We are able to hear you.
Hello.
Yes, ma'am.
Hello.
We can hear
Yes,
you.
ma'am. We can hear you. Yeah.
There was some slight problem in the connection.
Yes. Okay. So, ma'am, you were saying about home care for dementia people. Yes.
Hello.
Yes, ma'am. Please continue.
So again, with the family members that we were speaking of, the activities need to be a little light, on a lighter note, making it a little fun. Not that they need to do Sudoku every day, but it's more of what.
Okay. ठीक है. अपन questions भी होते हैं.
Prajakta, we can't
Ma'am,
hear you.
we can't hear
You're
you.
mute.
Ma'am, we can't hear you. Okay. Ma'am, we could not hear you. Hello, Prajakta, ma'am. Okay. ती muted.
समजतं आठवत राहत नाही आठवणीत राहत नाही समजतं सगळं आठवणीत
When Nanduला बोलो. Nandu can.
Okay, ma'am, पण ते नाहीच आहे तुमचं.
काय
Okay,
राहिलं तर
Prajakta, ma'am, I think we are not able to hear you, ma'am. So I think we'll just take a break. I'll call you later. Surgonda Patil, sir, can you please ask the question?
Prajakta, we can't hear you. Sorry. You're mute or.
I want to ask the question to Dr. N. Prem. Is here?
Yeah, please go ahead.
Can you please explain what is screening?
So screening is usually it is a set of questions which is done through a scale. So it is different for different setups. So we basically, for example, if you're doing a CAM, then it will be a different screening. In hospitals, a different screening depending upon. So it's a set of questions which could be asked. It was usually asked by either a geriatrician or by a neurologist or by a psychologist. So usually a team of 2 or 3 people do that, of course, if the numbers are more, but a short screening is done of a few questions, which helps us in knowing whether there is actually a greater problem. And if there is a problem, then a detailed screening is done. So that's what a memory screening is about.
Is that facility is available in Pune?
Yes, sir. Screening is available. Screening is available everywhere. By screening, I wouldn't say that. For example, if you go to a neurologist or a psychiatrist with, or of course, I mean, there are geriatricians in Pune as well. In fact, AFMC has actually started a department very recently. So that is also there, and then there are other centers as well. So yeah, screening can be done in Pune, sir. It's not a problem.
Thank you, sir. Thank you. Thank you, sir. Thank you, sir.
Yeah, well.
Dr. Prem, may I ask you one question? You had mentioned that changes in vision is one of the could be one of the indicators of Alzheimer's or dementia. And also, could you just clarify if too much of sleep is an indicator of thoughts as well?
See, by changes of vision, I obviously meant that because the neuroplasticity of the brain gets affected to a great extent. So the coordination, looking in the spatial direction and orientation obviously changes. So that really causes a problem. Then apart from that, see, excessive amount of sleep could be because of a lot of issues. Sleep in general, if a person has not been sleeping well for years together, that is actually taking away a big chunk of the memory storage. Because sleep is not only to be fresh, sleep actually is the place where your entire activities, whatever you have done, for example, you learn something, all that gets consolidated in the sleep. So that's why if you remember when we were kids before an exam, we are obviously advised to sleep early. It's not because we have to be fresh for the exam, but whatever we have read, that gets consolidated, and then we remember everything. So the retaining part, there is one thing about learning something, but the retention usually happens to a great extent in sleep. And the better the sleep, for example, as you age, around 6 to 8 hours is very good, but it doesn't mean 10 hours in the bed is good. It's like 6 hours of quality sleep will be better than 10 hours of disturbed sleep. So it's the quantity of sleep doesn't matter, it's the quality that matters. And it's again a myth that just because you're getting older, your sleep will reduce. No, nothing like that. There are a lot of old people who sleep really well. Then another question that most people ask about is the medicine for sleep, whether we should take or not. Of course, everything with medicine there are side effects, but I would say that under monitoring that can also be given. It is about whether you want to do certain things and whether you don't want to do certain things. If you want to take a medicine, before that also there are certain non-pharmacological things see, sleep is also a process. The type of the area, the room matters, how warm the room is, whether there's sound around. It should not have much lighting. Sometimes people like to read something to put themselves to sleep. It could be very light music before you try to sleep. Don't do overstimulating things just before you sleep. So that's also, you have to set the mood even for sleep. A lot of times we just feel you might be so tired that you just sleep off. People keep asking that I sleep where I'm in the chair. But I don't, when I go to the bed, I don't really get sleep immediately. So another thing is being sedentary is the new smoking is what has been found out during the pandemic. So I think activity, both physical and mental activity is very, very important, even for you to actually get better in your brain functions. I wouldn't say only memory, overall brain functions. That's why keep challenging and every part of your brain. That is how you can allay the fear of even having dementia or Alzheimer's at any point. So I think that would be the best sort of approach. Being active is very important, and sharing that enthusiasm with others also, because enthusiasm is also very infectious. So the more you do, the more you spread to others, the more others do. And ultimately, we'll have a community which is healthy brain-wise rather than people actually losing their memory.
Yeah, thank you so much, doctor.
Ma'am, Prajakta. Prajakta, ma'am, can you hear?
Yes.
Okay. I think you will agree with Dr. Prem what he was talking about engagement, because we actually basically we tried bringing you both of you today at the same platform because he was talking about the facts and how to deal with it, yet you actually shared your experience. So thank you, participants. Any questions? We are open to the questions now. So any questions related to what Dr. Prem said or what Madam actually shared? Yes.
Hello. One.
Kindly raise your hand or directly speak, no problem. Yes, Madhukar Parab sir. Parab sir, do you have any questions?
Excuse me,
Yes.
Padmavati here.
Yes, ma'am.
Prajakta madam, I just wanted to ask, is like, voluntarily, like any help? You need such centers, like, if not always, you can come once in a while and help you for dealing with such patients. I am staying in Daisar at Mumbai. Somewhere near about, if there is something I would like to help out from whenever I'm like, means
From the point of view of my own residential care home,
need necessary is there. Some people, they don't have any, not able to have the care because of so many reasons. So if some are there, I would like to volunteer, and once I know, then I can tell whatever free time I am having, I can find out.
yes, I can understand what you're saying. But while running my own residential care home, what I realized was it is a very specialized kind of care that persons with dementia would require. So volunteering is something I don't encourage readily. I would suggest a small, at least a small training course to take up any activity at such centers. So volunteering is more
Breaking,
as it is
your
need,
voice is breaking.
but taking up an activity needs certain kind of training. So I would suggest that, and all centers need to follow this, that certain training is needed right from communication skills to understanding of dementia
Yes.
and smaller nuances of it. Only then, yeah.
No problem. I just wished that I understood.
Absolutely. Most respected, and we really value volunteers. Most of our family members also offer to, but then we give them at least a training of 3 to 7 days, and then they can
Yes.
help us.
Great. Thank you, Padmavati ma'am.
Thank
One
you.
more, one more question. One more question to Dr. Prem.
Okay. Yes, sir.
Can you explain more about vascular? What is vascular health?
Okay. Dr. Prem.
So as I said, vascular health is basically the diseases which obviously you might have or had, like diabetes, hypertension, maybe a history of heart disease. So all these need to be controlled or maintained, whether it's through medical or non-pharmacological, which could be obviously diet modifications, exercise. So when you maintain that vascular health, obviously the risk of dementia, which can be due to these causes, decreases. So that's what I meant by vascular health, because that is another way of preventing having any cognitive impairment. I wouldn't say dementia, because not everybody with a memory problem or a issue is actually having dementia. People might have cognitive issues which might not be as extreme as even dementia. And as far as as far as Padmavati ma'am was, I just wanted to comment on that. In Bombay also there are a lot of organizations. To be very frank, there is an organization known as Graceful Living, with which I was sort of working as well. So it's an NGO known as Tulsi Trust. So you can mail me, and then I can get you in touch with them. We are always looking for volunteers, not necessarily in the dementia space, but in the elder care space, wherein of course training can also be given.
Okay.
So I think that is something we can get you connected to. So no problem.
Sir, but your mail ID, I don't know from where to search for that.
Yeah, I actually put it on the put it on the chat box as well. I can put it again, no problem.
Yes, yes.
Chat box, but how do I go about it? It is showing chat with everyone. Should I open that?
Yes, yes, ma'am. Yes, ma'am.
Okay, okay. I will do that and find. Yeah. Thank you so much.
Thank you, ma'am. Dr. Prem, we have a question from Roshni Asthana, ma'am. She's saying that to know
Yeah.
tips to converse with dementia or Alzheimer's. And another question is by Kedavala, ma'am. So we'll take that, these two questions for you. Yes.
Yeah, so I think conversing with a person with dementia, Alzheimer's, because I wouldn't say slash Alzheimer's, Alzheimer's and other dementias is what I would say. Because again, as I said, we shouldn't equate both because both are not same. I mean, Alzheimer's is a type of dementia, not the other way around. So I think it's very important, again, as I had mentioned, that you do not forget the person behind the disease. That's very important. You're not talking to dementia per se. You're not talking to the disease. So there is still that person. So respecting that is very important, respecting their dignity. Secondly, communication should be also taking care whether what is their hearing issues, because we tend to forget that it's only dementia. So anyways, they won't understand. That's not the way things go. One has to be very soft, one has to be very clear. If they have hearing issues and they don't use hearing aids, one has to go close to them and talk to them. Shouting, necessary high pitch, all these things are very disturbing and quite overstimulating for a person with Alzheimer's, so that should not be done. It's very important in communication that we realize we are not talking too much. By that, I mean, for example, if you are going to tell them, yes, we are going to eat food now. So it should be only focusing on that particular part that you are going to eat food now. It should not be we are going to eat food now. After eating food, we'll wash your mouth, then I'll take you to the bathroom, then I will freshen you up, and then you can change your clothes. So there's just too much of information which can complicate that thought process. So that's why it has to be very simple, in which even when you're trying to give food also, as I say, a lot of times this thali kind of place, things will not work with people with Alzheimer's because they get confused. There's too many things. So we often say that maybe one type of item can be given and tried, and then they will eat. Sometimes even, I'm just elaborating on the eating part also, because eating is one of the very important things to keep anybody fit. Sometimes one has to even eat with them. So they tend to, obviously, there has to be a sense of belonging and family even for a person with Alzheimer's. It should not be that they have another specific time for eating and the family eats at a different time, because they also want that sense of belonging. So I think that also is very important. Then in general, even stimulating them in a good way is good. For example, music therapy is good, pet therapy is good, intergenerational bonding has been seen. That has been sort of very good. I mean, there was recently, there was a observation wherein children, I mean, small children, that is infants, were taken to a facility, I mean, were close to a facility with Alzheimer's, and the way the people with Alzheimer's behave with them, they were so happy. So all those things were also sort of seen. So there are a lot of things which can be done. So one of the most important things is remember that there is a person behind the patient. It's not a patient or a disease that you're treating. I think if you respect that, then you would be able to obviously talk better. What was the next question? I don't.
It was about dosing of the day, sir. I didn't get the question, but yeah.
I mean, in general, of course, there are a lot of causes of people just sleeping off during the day. It could be because of obsessive sleep apnea. Also, it could be because of lack of sleep in the night. A lot of times, the way the rhythm itself changes in persons with Alzheimer's. So one has to make sure that we are able to at least tell them that what time of the day it is, even if they don't understand. It has to be a well-lit room, not too overstimulated, not too understimulated as well. And of course, consistent. I also believe that in a care for an old person with Alzheimer's, there should not only be pharmacological care first and then try that and then see if non-pharmacological works. No, it doesn't work that way. It is something which has to be done at the same time so that all the domains of the brain can actually help, and the pharmacological part, that is medicines, can be substantiated by whatever activities are done. So I think, yeah, that should answer that.
Okay, great. If any more questions, otherwise we will wrap up the session. Anyone?
I think I have asked the question, but I received the answer also. I got the answer.
Okay, okay. Thank you so much, sir, for joining. Yes.
Okay.
Over to Raze ma'am. Yes.
Thank you, Dr. Narasimhan and Prajakta, for really sparing your, I know, very valuable time on this at this time of hour. Actually, Dr. Narasimhan burst quite many myths that we had. Even one myth that I would like to point out about Alzheimer's not being fatal. I think that was something that really opened my eyes. Pointing out specifically that memory loss is just one of the recognizable symptoms. There are many other alerts that we need to be aware of. I think that has been quite a lot of information that most of us have learned. And Prajakta spoke quite eloquently about the fun activities that are taking place in her center with a secure environment, with trained caregivers, professional experts engaging in creative active engagement or activities in the morning and physical activities in the evening, all of which just point out to what we all need to take back as the most important message that Dr. Narasimhan spoke about, remembering that there is a person behind the patient. That is very important. And I think most of us have, in some way or the other, been in close touch with our relatives or friends or family members who have had various kinds of dementia. I think this has been a very, very informative session, and really very truly grateful to you, Dr. Narasimhan and Prajakta, for being here with us and allaying our fears as well as giving us a lot of information on this most important topic, which also happened to be the birth anniversary of our founder, late founder president, Dr. Sharat Chandra Gokhale, as many might be knowing. He was one of the pioneers in India to bring in this issue of population aging. So we are happy that all of you joined today. Thank you so much. I thank my colleague Yashoda for coordinating all of this, Sushant and all my other team members. Thank you so much. And we look forward to meeting all of you again in one of our other webinars. Thank you so much, Dr. Narasimhan and Prajakta.
Thank you. Thank you.
Thank you.
Have a good day.
Yes.
Thanks a lot.
Yes, thank you, ma'am. And thank you all of you for joining. If you want to get connected to us, then please, I have shared my number. My and Sushant's number is on poster. So you can anytime call or message. And please be with us. Thank you. See you. Bye.
Okay.